All right, it's recording.
All right.
Joey. Oh.
My name is Joey Moehler, and this is my training presentation. And here's the audience right here.
All right. Oh, in here.
Okay, this presentation is going to be over bystander CPR, and this is for people that are not in the medical profession, just for bystanders. All right. What people don't know is that the first 4 minutes of somebody collapse that are not breathing on the pulse is most critical for their mortality rate. And most Americans, probably about 70% of Americans, do not know how to do CPR. So if you do know how to do CPR, you've just increased this person's survival rate by about 80%. And another thing that people don't know is that Victoria, our response time is about 6 minutes. So the first 4 minutes are most critical. So whoever knows CPR, that's what's going to determine if this person lives or not. So let's get started. Imagine you're at a store, you're with your family. It doesn't matter. Somebody automatically they collapse for no reason. They just fell on the ground. They're not breathing. They're not responding to you. What do you do? Okay. So the first thing you want to do is you want to kneel down beside them. If you look at them and check for their responsiveness. All right. You want to shake them. Do whatever you got to do. Hey, buddy, you okay? If they're not responding, next thing you want to do is check to see if they're breathing. Now, the new AHA guidelines, or American Heart Association guidelines, said that they don't want you to check for a pulse anymore if you're not in the medical field, because you're just wasting time. So shake them, hey buddy, you okay? And then look to see if they're breathing or not. You don't have to do the look, listen, and feel. All right? So they're not breathing. Next thing you want to do is you want to take out your phone, call 911. All right? Once you call 911, you can put it on speaker, lay it down beside you. And if there's somebody else that's there, have them call 911. And also ask them if they can go get an AED. So the person's not responsive, they're not breathing. Next thing you want to do is you want to put your hand right here, the heel of your hand, right in the middle of their chest. And you can take off their clothes if you need to. Find the middle of their sternum right here. Okay, put the heel of your hand right there. Get your other hand, put it on top, and you want to lock your elbows. All right. And what you want to do is you want to do about 100 compressions per minute. And if you don't know how much that is or how fast that is, it's to the song of Staying Alive. So you're going to get over the patient like this. You're going to start compressions. 1, 2, 3. And you want to go at least 2 inches deep. If you don't know how much that is, that's about this blue area right here, okay? So you want to go at least 2 inches deep. If you go further, that's fine. If you break their ribs, that's fine. That's normal. The person would rather be alive with broken ribs than not alive with ribs, all right? So start your compressions. You want to do 30 compressions, all right? So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And you want to count out loud, okay? Once you get to 30, you have an option. You can give them breaths if you want. If you don't want to, that's fine. Just keep on doing compressions, okay? If you do want to give breaths after 30 compressions, you want to tilt their head back like this. You want to pinch their nostril and put your mouth over theirs and give them 2 deep breaths. All right. You want to look at their chest as it's going up and down. Okay. So keep on doing it. You want to do 5 cycles of this. All right. 1, 2, 3, 4, 5. Once you get to 30, tilt their head back. Give them 2 more breaths. After 5 cycles, you can check for a pulse. All right. And their pulse is right here, right where the carotid artery is. So put your hand right here, check for a pulse. All right. Now, some people, they don't want to do this, and there's a new thing that the AHA came out with called hands-only CPR. All right. You can just do compressions the entire time and not give them breaths. And the reason for this is they're saying that when a person collapses, they usually already have oxygen in their blood. And if you could just get that perfusing through their body, it'll increase their mortality rate greatly. Okay? The breaths are not really that important. If we can just get the oxygen to their organs and to their tissues, it'll keep them from dying. And hopefully you can do this enough time, 4 or 5 minutes is enough time for us to arrive and start giving them oxygen. Okay? If you take anything away from this course, it's 2 things. One is compressions first. There's no more ABC. There's not airway breathing and then compressions. It's compressions first. You want to get that blood flowing in their body. 2 is, remember, the beat is staying alive, okay? I'm not going to sing it for you, but if you want to know what it is, Staying Alive by the Bee Gees. You want it, and if you can't remember even that, just push hard and fast as you can. The first 4 minutes are the most important in somebody's mortality rate, okay? It takes us 6 minutes to get there, so by you knowing this, you can increase their chances to live by 8%. For every minute that they're down without somebody doing CPR on them, that's another 10% less mortality rate. So if you think about it, you got 8% chance if you're doing it. If you don't, by the time we get there, their chances of surviving is probably 20, maybe even 10%. So hopefully you've learned something today, and I do have handouts if you like. Just get in contact with me, and I can send them to you via email. And I hope you have a good day. Thank you.